Welcome to week 9 of the Leukopak Lady. I'm continuing to walk through regulatory topics relevant to starting materials for allogeneic cell therapy manufacturing. Today, I will discuss a topic that is apparently the hill I will die on. Leukopaks are blood products, not tissues. So this was something I noticed about a year ago when I was exploring how to register a tissue establishment for a company I was trying to start. To register as a tissue establishment, you must collect tissues, as defined by the FDA. In 21 CFR 1271, Part A, HCTPs, or human cells, tissues, or cellular and tissue-based products, are defined as, quote, articles containing or consisting of human cells or tissues that are intended for implantation, transplantation, infusion, or transfer to a human recipient. Simple enough, right? 1271 Part A, Section D provides a long list of examples of HCTPs, including organs, bone marrow, and hematopoietic progenitor cells from peripheral blood and cord blood. However, also in Section D is a list of the products that are excluded from qualifying as HCTPs. And in bullet point 2, the FDA states as excluded from the definition of tissues, quote, whole blood or blood components or blood derivative products subject to listing under Part 607 and 207 of this chapter, respectively. So it appears that blood products listed under 21 CFR 607 are not tissues. So my main question now is whether a leukopak is classified as a blood product, since it's primarily made up of white blood cells. The name leukopak is a made-up word to describe concentrated leukocytes collected by apheresis. The Blood Establishment Registration documents from 607 defines under blood products source leukocytes as, quote, white blood cells intended as source material for further manufacturing use. However, this does not indicate whether it applies to only white blood cells collected from whole blood by manual methods or if it includes apheresis. There is a compliance program guidance manual for the inspection of source plasma establishments, brokers, testing laboratories, and contractors. Chapter 42 of this guidance covers blood and blood components and defines human source leukocytes as, quote, human leukocytes or white blood cells prepared manually from whole blood or collected by apheresis and intended as source material for further manufacturing use. So leukopaks are source leukocytes. And the definition in both of these regulations defines source leukocytes as intended for further manufacturing use, which is also true of leukopaks intended for use as starting material for the manufacturing of a cell therapy product. So if you're an establishment that collects leukopaks or plans to start collecting leukopaks, you actually can't register as a tissue establishment. You must register as a blood establishment and follow regulations for blood products in 21 CFR 607 and other sections in the 600s. So with all that said, the final manufactured cell therapy product does qualify as a tissue because it contains human cells intended for transfer into a recipient, which meets the definition in 1271 Part A. So the regulations I talked about in the last video will apply to donor qualification, eligibility, testing, and collection of the starting material, even if the starting material is not a tissue. And even though an establishment that only collects leukopaks can't register as a tissue establishment, they can still follow regulations related to tissues outlined in 1271 to produce starting material that is compliant with good tissue and good manufacturing practices. So on the next 2 videos of the Leukopak Lady, I will go over the details of good tissue practices and good manufacturing practices for producing starting materials that can be used in the manufacturing of a cell therapy product.